people that have joined us today. So that's a really good number. And just I have a couple of announcements here, not tons today. So if there's anybody out there that would like to share any announcements, please feel free to do so after I go through a couple things here on the Rotary end. Meals with a Mission is 2 weeks away, December 7th. It's hard to believe. Currently, we're right at around 80 tickets sold. So we've got, if you have not bought your tickets yet, as a Rotarian, please do that. They're available on Facebook. They're available through Eventbrite, or you can call Greg Long's office and he will take care of making sure that you're billed for those tickets. So it would be nice to have at least 250, 300 tickets sold, not only for the club, it's a money generator for us, but then also it would be good for TJ's as well. So,
hey, Justin, is there a way you could send an email with that Eventbrite link? Because I haven't signed up for those tickets yet.
No problem, D. I will make sure that middle of this week, it's more, out in front of your face. It has been in the emails. So if you do see the block there, if you click on it, it will take you to the ticket sales.
Right, great, okay. Thanks.
But I will do that, D. I'll make a note on that. So just make sure you get those funds in. For those who have volunteered for our bell ringing, we are full, and thank you for that. So that'll be happening here next couple weeks. We only had 3 or 4 days that we volunteered this year, being a special year, but we are still upholding that tradition of making that happen. Every Rotarian every year, there will be a campaign to support every Rotarian every year at the local level. So a number of people have said they've got solicitation from the International Rotary International. If you'd like to support them, feel free to do that. Feel free to send your money into them. But really, our club will get no credit if you send it to Rotary International. So don't worry, folks. We'll come around with our Every Rotarian Every Year campaign, probably right after the first of the year. A quick update on our 100th anniversary. I know that Phil Mariola was on the line. Phil, I don't know if you want to give a quick update, and I know I'm just putting you on the spot, and if not, then I will. But Phil, do you want to give kind of an update real quick or not? I'll take that as a no. Okay. So we were really looking at trying to have the event in March and April. But obviously with an ever-changing world and situation, the committee did meet on Friday. We had a nice meeting, and we decided that we are going to have our 100th anniversary, but the date, it likely will be later in the year. It could even be a summer or even fall thing of 2021. So you won't see tons of details on our 100th anniversary because we're going to push that back to make sure that everything gets cleared up here. Those are the announcements from Rotary, unless Lynn or Greg, Terry, am I missing anything just from a pure Rotary perspective?
I'll get it. That seems to be it, Justin.
Lynn, you had something?
I just say, just everyone please check chat. Daryl Lee has a nice announcement regarding people to people.
Excellent. I'm sorry. Daryl, do you want to give a quick overview, bud? Sorry about that.
Yeah, can you hear me?
Yes.
Okay.
Yep.
Yeah, we had, we collected food, it was a little older this year, but we collected food over November 6th and November 13th with Tri-Way School District and with Wooster City. Ended up collecting over 25,000 food items and over $1,000 in cash that was given to people. Joe was very excited. We weren't sure what we were going to collect this year and how that would look. And it was pretty exciting to see the numbers that we were able to do. And, the easiest thing would have been to cancel it this year. And both Dr. Tefts and Nate Schindelwolf said we can't afford to do that. So with their leadership, we were fortunate to have it go through, and it was a nice success. Definitely thank you to Paul Williams, Justin Starlin, Joy Smits, Becky Foster, Terry Snoddy, for those that were involved in the food collection. Couldn't have done it without you guys.
Excellent. We have just about 5 minutes. Anybody else have any general announcements to share, either community-wise or that would be beneficial for the organization? If not, then Doug Druschel, you have the honors of introducing our speaker today. And folks, we're at 78 people have joined our Zoom, so good numbers. Also, real quick, I should mention this. If you have a question for Bill, and Bill's always open to any question, feel free to put it in the chat, and we'll make sure that those questions are facilitated. So, Doug, off to you, buddy.
All right, thank you, Mr. President. This will be very brief. Our speaker today is Bill Sharon. Most of us know Bill. He's the longtime CEO at the Wooster Community Hospital, where some of us were even born. Bill's been very successful.
You sketch it out for me first, and then we'll figure out how to build it, okay? Draw.
Okay, there we go. The joys of Zoom. Everybody tell their dog to shut up and keep it on mute. In any event, Bill's been very successful, had a very long, successful run at Wooster Community Hospital. And I've also always found Bill to be very interesting in terms of a broader perspective on healthcare issues. And given the fact that we're in the midst of not only a local issue, but a global pandemic, Justin thought it would be a good idea to take this meeting today to get a little update from Bill and allow Bill to make a presentation. And we have perhaps plenty of time left at the end for Q&A. So tee up your questions in the chat and be ready to go. Without further ado, Bill, the floor is yours. Bill, you need to unmute.
Hold on, Bill. We're going to unmute you, man. Hold on. Now give it a shot. Can you hit the unmute button there? Let's see.
Is that better?
Oh yeah, perfect.
Didn't even know I muted it. That's what I love about these Zoom meetings.
Yeah.
You know, Justin said the format here would be kind of a fireside chat. The best I can do with that is to turn on my radiator. So if I leave in the middle of the presentation, that's my fireside. You know, I have some questions that Justin submitted to me ahead of time, but I thought I'd just start a little bit freelancing at first. I've been a hospital CEO now for 35 years, and clearly this has been the greatest challenge I've faced throughout my professional career. No question. You know, we started this journey, if you will, for all intents and purposes last March, and we're still in it. And we don't really see a near-term exit here. I would think we're going to be dealing with this COVID in the next summer. That's just Bill's opinion. But by the time we can get out and get vaccines into the population and see results from that, I suspect we'll be looking at early next summer. So it's been a real rocky road for the last 9 months. And I think the hospital probably felt this first before many of your businesses did. And I know this has been difficult for a lot of businesses. And throughout this pandemic, I've talked to a lot of business owners and business operators locally and around the country, and other hospital operators around the country. And certainly we're all in this together, but we got hit early because as soon as the state government decided this was a pandemic and that they would deal with it, they really shut down a lot of routine hospital services. So for us, it was difficult because on the one hand, they turned off our flow of patients and our sources of revenue, yet they told us to prepare for this huge wave of patients that would be coming. So we had, no revenue, people furloughed or working in other roles, but we were told, get ready. And back last April, we were told to expect 270 COVID patients per day at Wooster Community Hospital. Now, to put that in perspective, we only have 172 beds. So at the very time we were scaled back from providing services, we were told that, the waves were going to wash over the ship. Now, we knew the state's numbers were wrong. Their modeling was based on some European models and so forth. And we communicated with the governor very early that we thought his numbers were more than optimistic, because while they were predicting 270 patients a day, the most we ever saw during that period was 12. So, but COVID has stayed with us, and actually our spike is occurring now. We've started to see an increase again in mid-October. So we have 25 COVID patients in the hospital today, and we've had between 25 and 30 for the last several weeks. So that's a lot for us, and that's high for us. But everyone around us is experiencing the same thing. In fact, we've been taking transfers from other hospitals because they are full. So we took, I believe, five patient transfers from Altman this weekend, just to help them out as well. So we stay in touch with all the other hospitals, but it was very frustrating early on to try to deal with these predictions and mandates, because we had to provide the equipment, the PPE for this onslaught of patients that never came. So anyway, that's sort of my brief intro from where we were to back then to where we are now. A lot of things happened along the way. Justin, do you want to talk about any of your questions that I can specifically respond to, and I can elaborate off of that?
Absolutely, yeah. And I know, Doug, you have some questions as well. So talk to us just overall, so your capacity at the hospital, Worcester Community Hospital. I know that you had plans for an offsite facility as well, Bill, and really today, where would you feel comfortable capacity-wise?
Yeah, we're probably at 90% capacity. We still have room for more patients. But again, back in the day, we were preparing countywide with a lot of other entities to provide overflow. And one of the people we reached out to right away was the College of Worcester, and said, hey, you guys are shut down right now. What about the Long Break Wellness Center? And Sarah was great, worked with us, her staff. So we were planning Long Break as an overflow facility if we needed it. And we looked at other facilities as well. As you remember, New York City was going through this dreadful situation where they overran the morgues in the area. So we were looking at, do we need to go out and buy lease refrigerated trucks? We were going through all different scenarios through our incident command structure. And again, fortunately, none of that happened here in Wayne County. But those are all the things we had to do. And we went through about a 2-month period where we really turned the operations of the hospital over to an incident command team. And keep in mind, as a hospital, we prepare and drill for all sorts of emergencies, medical, natural disasters, those kinds of things. We do that all the time with the county, but never for this kind of duration. I mean, everything we prepare for is typically a 3 to 4 day event. And when we started getting into month 2 and month 3, it was uncharted territory for us operationally, because we had increased expenses. We took all these key managers out of their regular roles, put them in an incident command structure, but had to backfill their positions with other people. So our costs went up, our efficiency went down. We really couldn't process patients through. And then on top of that, the state said, you can't do this and you can't do that. I think a lot of people thought that the state's restrictions on hospitals were intended to protect patients or hospital personnel or maybe physicians. That really wasn't the case. The reason they suspended hospital activity was to protect the hospitals from being overrun with patients. So again, it's we've learned a lot in the last 9 months, but we're not out of it yet.
Doug, do you have a question?
Yeah, Bill, there's been a lot of discussion in the news the last week or so on the vaccines, which looks like they are going to be successful. What's your understanding of the distribution of the vaccine? Will the hospital be involved in that distribution process?
So the answer is yes. Yeah, the vaccines have really come a long way. I'll be honest with you, in the last couple of weeks, as we've seen some of the results from these 2 or 3 front runners, it's really encouraging. The way the vaccines will, and we've placed orders for vaccines, we don't have them yet, but they will be distributed regionally. So in our region, the largest hospital is Altman Hospital, so the vaccines will go through there. That doesn't mean that they'll keep them, and they will distribute them to all other hospitals, including ourselves. But it'll the state has set up kind of a regional distribution system, and we're very anxious to get these vaccines out and in the public. And as I said, we've ordered them already, specifically the Pfizer vaccine, but we await their distribution. And that really has been the greatest challenge for us through this whole epidemic or pandemic is supplies. One of Justin's questions had to do with PPE, something, 3 initials we probably didn't know of 10 months ago, personal protective equipment. We've never had a real issue with enough gowns or gloves or masks. There were times we were running short, but we never ran out. But the thing we really have had a difficult time with, and this was really a problem at the federal level too, was testing supplies. Because there's plenty of equipment out there to test for COVID, but you don't have the reagents or supplies to actually do the testing. So we all have the machines. We have 2 machines here, but all of our testing supplies since the beginning of the pandemic have been on allocation. Allocation means you order as much as you want, but they send you what they have to send. And typically we get about 50% of what we order. So we've had to be very careful with our testing, which is why we haven't been able to test everyone in the community or everyone that wants it in the community, because we really need to preserve the test for patients first, patients who are in the hospital. So that's been a real challenge for us.
Bill, following up on the PPP issue, when this first started hitting the news, there was a lot of concern about the supply of various items, and especially the items that were manufactured overseas. Are you aware of any effort by political leaders or the medical community to come up with a list of things that are critical for the nation going forward that we simply need to have made in the United States, so we don't have to worry about international supply chain the next time something like this happens? It seems to me there would be room there for a bipartisan approach to that. I just wondered, do you know anything going on in that regard?
Well, I've heard at the federal level, obviously they've woken up to this, and by the way, it's not just the PPE, it's the drugs as well. We discover in the midst of this pandemic that many of our drugs are manufactured in China, which is disappointing. And frankly, a lot of the PPE did source from China as well. One of the things that I want to thank the community for is the outpouring of local support for the hospital. Once it became apparent that PPE was an issue, we had, for instance, Scheffler approached us and said, "Hey, boy, we've got a bunch of masks that we use in manufacturing. We'll give them to the hospital." We had, meat cutters giving us gowns. The college gave us some masks. We've had all sorts of local support. People sewing. We had hundreds and hundreds of hand-sewn local masks that came in, all of which were much appreciated and much needed. Of course, now we're hearing, the whole narrative has changed. As I look through this thing over 9 months, in the beginning, we were very much worried about how is this virus, transmitted, and it was hard surfaces, and we had to clean, and we were cleaning all the doorknobs and doing all the ultraviolet light machines and so forth. We bought robots for that purpose. Of course, now we're in an age where it's aerosolized, and what we're most worried about is masks. We weren't talking about the mask as much in the beginning of this pandemic. And even the masks, we have a lot of folks wearing kind of color coordinated, fancy cloth masks. They're good. But what I've been hearing recently is if you're traveling, really an N95 kind of medical grade mask is probably 90% effective at protecting you and people around you. Some of these homemade jobs may be down to 30% effective. So masks do make a difference. And I think particularly if one is to travel this weekend and anytime soon during this pandemic, be careful. Not every mask is the same. So I think but as we go through this, we learn more and more and more, not to wax political, but I actually think the federal government did a pretty good job helping hospitals. I mean, certainly without the CARES Act funding, I think every hospital in the United States certainly would have been operating in the red during this pandemic. Many would be on the verge of bankruptcy. They did a great job with ventilators. That was never a problem from us. We've always had enough ventilators. They did a good job in New York with the hospital ships and putting up 10 hospitals. I give kudos to the federal government for what they did, but they were a little optimistic about testing supplies. Again, there were a lot of machines out there, but not the equipment to run them. And now masks is on everybody's mind. And I think the government has done a pretty good job at helping hospitals. From where I sit, from the hospital perspective, I've got few complaints about the federal response.
Bill, I've got a question here from Ron Amstutz. So the breakdown of the COVID patients versus your other patients population again, I know, and have you seen your core business obviously take a hit just from the foot traffic because people are basically doing deferred maintenance, right? Are they're essentially staying away? And what has been the trend over the last 30 days with COVID patients?
So as I mentioned, last 30 days, we've seen a spike. And the last 30 days, we've probably averaged somewhere near 20 COVID patients per day in the hospital. Now, prior to that, from March through October, we were averaging more like 6 or 7 COVID patients. So you'd see the national news, you'd read some articles in the paper about this horrible epidemic. But truthfully, we never saw that kind of activity here. In fact, since March through today, there's only been 22 COVID deaths in our hospital. So that's 2 a month, 2 or 3 a month. So we've really not had much COVID activity until now. But as far as the ramifications on our business, you're right, Justin. I mean, as soon as we hear this, people start thinking, oh my gosh, the one place I don't want to go is the hospital. I don't want to catch COVID. When in fact, we didn't have very many COVID patients. And then I would argue, again, I can make this claim, that this is one of the safer places to be in the community because of all the screening we do, the checking, the special way we disinfect. We have the ultraviolet light, robots which kill everything. Obviously, we've been temperature checking people. We've reduced visitors. In fact, we've had very little COVID exposure in our workforce. Between the hospital and Bloomington Medical Services, which is our subsidiary, we have over 1,200 employees. In 9 months, we've only had 80 positive employees, total 80. And by the way, as we've contact traced most of those employees, they did not get COVID here at the hospital. They got it in a social setting. So we would argue the hospital is a relatively safe place to be, but winning that argument in the court of public opinion, I think, is a losing fight. And a lot of people are frankly afraid to come to the hospital. A lot of physicians have cut the number of patients they've seen. A number of physicians have cut the number of patients they've seen in person, using telemedicine as an alternative way of delivering care. But it's probably reduced our revenue by 20 to 25% over the 9-month period, which is a big deal for any business.
You see, Bill, with that, a concern about the health of those people who are not coming in to get something taken care of?
Well, I do. That's a real concern. I think people who are delaying care, not seeing their doctor, or maybe being put off into a later appointment. So the concern is, and we've seen some evidence of folks that have put off things that really shouldn't have put them off. Another statistic that, again, might not be much to the public, but just to talk about the average COVID patient here, when this all started, we were told that the average length of stay for a COVID inpatient across the country, how long they would be in the hospital if they had COVID, was 17 to 20 days. Now, that's a long time to be in the hospital. Our regular length of stay in regular times is less than 3 days. But our COVID patients have been here on average less than 6 days, which tells me that the acuity of our COVID patients at our hospital is relatively low. And we've never, as I said, never exceeded our ventilator capacity. So it seems to me the patients we're getting are less sick than we're seeing in a lot of some of these other areas. Again, a good thing.
Hey, Bill, to piggyback off of that, is there a typical COVID patient, and have you seen any influx of the Amish population? Because I know that was a national news article about Wayne County and Ashland County. Have you seen that?
So we have. So the first group, the first cohort we had that really pushed our numbers up were frankly nursing home patients. Early on in this pandemic, we got several spikes in local nursing homes, and those folks came to the hospital. Then we leveled out. We went many months with very little activity. And again, fairly recently, starting in October, we started to see Amish patients coming to the hospital in numbers we've not seen before. So those are the two groups. I would say when we look at the age distribution of our patients, again, most of them are in that 60 and above range. Certainly those on the mortality side, that's where almost all of the mortality is. But we've seen, teenagers on up here at the hospital with COVID.
Bill, in terms of the treatments provided at the hospital, there's a lot of news over cutting edge treatments, and some things have worked out, some things haven't. What can you tell us about what's being done here compared to nationally? There's some news about President Trump getting a special kind of a treatment that was not otherwise readily available. What can you tell us about that?
Well, so he got the Regeneron treatment, among others. And that is, as of today, I was told this morning, that will now be available nationally. So we've checked with a lot of other hospitals, major hospitals around the country. My daughter happens to be a clinical pharmacy manager at the largest hospital down in Raleigh. I speak to her every couple of days. We can offer any treatments that any other hospital can offer. Maybe not what the president can get, but all the remdesivir and all these things that you've heard about, those are offered at Worcester Community Hospital as well. But one of the latest trends in treating COVID patients, and these would be COVID outpatients, is with antibody testing. So these would be people that come to the emergency room, they test positive for COVID, but they're not sick enough to be admitted. Those folks now are getting an IV, like a 2-hour IV therapy, and then they're out in 2 hours. We will be starting to administer that within the next day or two. So as far as therapeutic treatment, I think we have to offer anything that any other hospital in the country has. Certainly any other community hospital.
Bill, let's talk about testing. I had a couple of questions come in here just about employees, or also just relatives, family. What is the best place to get tested today in Wayne County? And at what point are we going to have tests that aren't 3 to 4 day wait for results?
Yeah, so the best place to get testing in Wayne County is wherever you can find it. Again, as I mentioned earlier, we don't have the ability to mass test everybody. We've had several major employers call us and say, hey, I've got 300 employees kind of running through the hospital. And the answer is you can't, because we don't have the reagents to test them all. So we are still testing on a priority basis, all of our patients, all of our inpatients, anybody who's going to have surgery. And we're also sending a lot of tests out. The health department is doing the same thing. They've got a lot of outreach clinics, but a lot of their tests are going off to LabCorp and these big national testing laboratories. The problem with the testing laboratories is they take, 3 or 4 days to get the results back. Now, again, we offer results, rapid cycle results, but we don't have the ability to offer them to the population yet. Because you would argue, and I think you could make a good case, and we've said this all along, I could get tested today and wait 4 days for my results, go out and test negative today, in 4 days be positive, and have infected 100 people while I'm waiting for my test results. So what we really need is kind of instant test results. Now I've seen on TV, there's apparently somebody that is out there, you can get tested at home and get results in 30 minutes. And I would just say, if you can do that, do it. Here in Worcester and in most cities, my son lives in Nashville. It's hard as heck to get tested in a big city like Nashville. He's had to be COVID tested, and he had a heck of a time finding a place. He finally got something done at Vanderbilt University. So that testing has been the big problem for everybody.
Should we be testing more, or are there too many people asking for a test that really don't need one?
Well, as a healthcare professional, Doug, I'd say there's probably a lot of people asking that don't need them. But realistically, until we test everybody and until we decide who's got antibodies, we've got antigen testing, who's got antibodies. Until we do that, we're really not going to have a handle on this thing. But unless you're symptomatic and you're really feeling, I've got all the, symptoms that they tell me I'm supposed to have, I certainly wouldn't rush to test. Again, I think it just overburdens the system, and I think it wastes resources.
I got a comment here, Bill, that I want to read. The Mental Health and Recovery Board appreciates the work of the Wooster Community Hospital Emergency Department and also the Wooster Community Hospital Recovery and Addiction Medicine Program, providing treatment for people experiencing mental health and addiction during that pandemic. And have you seen an increase in that in the mental health?
We have seen an increase in that population, and again, we're an acute care community hospital. We were really never set up to deal with the mental health patients, behavioral health patients. We have an outpatient behavioral health program, but we're really not set up to deal with the inpatient and the really acutely ill mental health patients. And that number has increased during the pandemic. But again, the community has worked great. We've worked in great cooperation with 180, the health department. Everybody, I think, has done a terrific job in this community to work together to get through this thing. And I appreciate their comments, but I echo back to them. Without them, we couldn't function either. And as I said, we've reached out to a lot of folks in the community that have had open arms and helped us any way they can.
And then kind of piggybacking off of that, Bill, a question was just morale of your employees. So as you have seen that ramp up of COVID in the hospital, have you been making sure that the staff there in the floors of treatment, that they're doing okay mental health wise?
Well, we have. That's a real issue. So at no point have we been out of beds or even close to out of beds, but staffing has been short. So we've done a lot of morale building, a lot of team building during this pandemic, because it is, it just wears on you. The first month of this pandemic, my whole senior team was in here 60, 70 hours a week. I mean, we were in the hospital. Somebody was in the hospital 24 hours a day. And you can do that for a week or two or maybe three. But as we got to week 6 and week 8, it does kind of wear down on you. As I said, fortunately, we have not had a lot of staff test positive for COVID. If half our staff was out sick, we would be it would be problematic. But I think they've taken the proper precautions. They've got the proper PPE, and knock wood, most of them have not had the disease. But morale is an issue that we have to look at going forward, because the longer this thing drags out, just the more difficult it is for everybody to take care of these patients. I mean, if you can see a patient via telemedicine if you're in a doctor's office, but if you're a nurse, you got to go in the room. I mean, you can't take care of the patient from the nurse's station. You're in there, face to face, and that's respiratory therapy, that's pharmacy, that's environmental services, that's the whole boat. So it has been a challenge for us, and but we're aware of the challenge. And again, we talked to other hospitals about it and how to deal with it. And we've had food trucks in here. We've had some churches in the community support us with how can we get food to the hospital, and the employees very much appreciate that, because they are on the front line. There's no question. You talk about the front line, it's here.
Are you still using the volunteers at the hospital, the pink ladies and so on?
So early on, again, we did away with the volunteers. We said they were at high risk. We sent them all home. Selectively, we brought some of them back, those that we felt to be at lower risk. But again, as we've spiked again, we've had to revisit that. Do we send everybody home? One of the things we do, like many other businesses have done in town, is who can work from home. So we're revisiting our work from home policy. We have van drivers that do free transportation in the community. We've had to suspend that service. We had the health coaches program with the College of Wooster. We've had to cut back on that program and suspend a lot of that activity. So a lot of what we do routinely, we've had to really stop or change because of this pandemic. And we know who's at high risk, and those are the people we need to protect.
We have just a couple more minutes, so if anybody has a question, make sure to put it in the chat. And while we give maybe a minute or so for their other comments to come in, Doug, maybe you can field that. Bill, is there anything individually, if we, have a burn in our belly to help the hospital out, or as an entire group, a Wooster Rotary, is there anything that we could do to assist the hospital at this time?
No, I think just give us your continued support. We have had a lot of people that have donated money to the hospital for the COVID relief. We haven't actively solicited that in a hard way, but people have picked up on that. But you have to realize how difficult this makes our life. And I'll use myself as an example. I had an MRI done on my knee a few weeks ago. And, what I had to do was drive out of the parking lot, call them and tell them I was here. Then they told me when I could come to the waiting room because we didn't want multiple people in the waiting room. Between each patient, they have to, clean all the equipment as never before. So maybe we could do 15 or 20 patients in a day before the pandemic. We can do half of that now because of all the cleaning and so forth we have to do. So it's really, really hurt our efficiency. So, but just I think the support of people understanding that we're out there really trying to lead the community through this. One thing, and Justin, you're sick of me talking about this, but one thing that we always talk about here is let's lead. Let's not just wait for what the governor's going to say, and let's try to lead through this. So I hope the community has appreciated our leadership in many of these areas, and because we have actively tried to do that.
So question in the chat says, is there any validity to those with type A blood getting a worse case of COVID than those with other blood types?
So Dr. Bill doesn't know the answer to that. Actually, I have type A blood, so I don't know. I don't know the answer to that. I'd have to follow up with the medical people, the clinical folks, to get back to you on that. I'm not aware of it, but it's possible.
Is there any local source for N95 masks?
That I don't know. Again, as I said earlier, there's N95 masks that you can, if you're going to sand sheetrock, you can buy it. You used to be able to buy N95 masks in Lowe's or the hardware store, but medical grade N95 masks, I'm not sure where. Again, we buy everything on a wholesale basis, so I'm not sure from a consumer perspective. Certainly if you come to the hospital and you're getting tested and you don't have a mask, we'll give you one.
Bill, could you clarify something? You have 172 beds, right?
Yes.
In your campus.
Right.
And so you currently have about 25 COVID patients, and
Right.
you're saying that you're at 90% capacity. So how does that work?
Well, so when I say we have 172 beds, that's total beds in the hospital. So that includes nursery beds, that includes obstetric beds, that includes skilled nursing unit beds, that includes inpatient rehab beds. So that includes all the services we provide. So when I said earlier we're at 90% capacity, what I meant was the total hospital was 90% full. That doesn't mean we're 90% full of COVID patients. That means the hospital is quite full right now of all kinds of patients. For instance, our ICU has 10 patients in it today. Only 3 of them are COVID patients. Does that make sense?
It does. Thank you,
I
Bill.
think we lose track of while we're dealing with COVID, we're delivering babies, we're replacing people's hips and knees, we're taking care of other sick patients as well. So we take all comers here.
Doug, do you have anything else for Bill?
Yeah, Bill, there's a question about you mentioned the number of your employees who have tested positive. How does that compare with other healthcare facilities, the large hospitals and so on?
I don't have national data. I believe our numbers are lower. We're on a regional call with all the other hospitals at least 3 times a week. Our numbers are lower than the Akron hospitals. That I know for sure. I believe our numbers are lower than the Canton hospitals. As I said, to have only 80 positive tests over 9 months is really remarkable because these are the people that are taking care of the patients. So that, we feel that our employees are well protected. And as I said, we believe those that get it, even the physicians, the few physicians that have gotten it here, don't seem to have gotten it from patient encounters. They've gotten it from other things they were doing or, eating lunch with other folks, that sort of thing. Again, if I could leave, one final message for the Rotary and the community, it said, we really feel the hospital is safe. We really feel it's one of the safer environments in the community. We've gone overboard to make it that way, from employees on down. But, you know, again, please understand, we seem to be in yet another spike again here and have been for the last month to 6 weeks. And you know, we're going into a holiday weekend. We worry about that because it's, you know, people are going to be gathering together again and doing what they do. But, you know, we've never been at full capacity here. We can always take more COVID patients. And, you know, we're witnessing that this weekend as we took patients from Stark County because they were overflowing. But Stark County and Summit County seem to be really hot spots right now.
Do you
As
separate,
is the Toledo area, I've been told.
do you separate the COVID patients from the others in the hospital?
Yes, so we call it cohorted. So we try to put them together whenever possible so that, you know, they're not interspersed with other patients. I think that's another concern. People say, well, gee, you know, my loved one is in the hospital. They're going to be next to a COVID patient. First of all, we have all private rooms. Second of all, all the COVID patients that we can are in what we call negative air pressure rooms, kind of isolation rooms where the air doesn't flow out into the hallway. So we take every precaution we can to segregate those patients and to cohort them together so they don't infect others.
Okay, Bill, I think that pretty much covers it. So we were at 30 minutes, Bill. So thank you for your time. We greatly appreciate it, Bill, your leadership and your support of the community, Bill.
Well, you know, if you've got questions, call the hospital. We'll answer them any way we can, and we'll get through this together. Thank you.
Absolutely, folks. Yep. So again, Bill, thank you for the quality program. Remember, Meals with a Mission tickets are on sale. And I did have a comment here. Are we gathering people for a dinner? We are likely going to encourage people for the drive-through component with Meals with a Mission. So again, really important to us, and it's really important to TJ's as well. So let's continue to support Meals with a Mission this year, even if it is drive-through. So Doug, thanks for co-hosting today. We appreciate it. And if you want to, there will be a video recording of this on YouTube. So if you want to share it with any of your family or friends, we'll send that to you in an email on Wednesday. Folks, have a good rest of the weekend. Happy Thanksgiving to everyone. Enjoy the week. Take care.
Thank you.